mental health and your hormones. I'm Dr. Doug Weiss, licensed psychologist, and been treating patients for over 35 years. Now, when you're dealing with mental health issues like anxiety, depression, it's very easy to overlook hormone dysregulation. But balanced hormones are vital, not only for like a healthy body, but also a healthy mind. Hormones are chemicals made in the glands of the endocrine system, are regulators of many of the body's processes. They control your metabolism. They can control your mood. They can control your reproductive function and even affect your sexual health. Many people don't understand the connection between the hormones and mental health. Understanding the link between the two can help people understand when there could be an issue with the hormones and affecting them. Today, we have a highly qualified medical practitioner with an extensive background in adult medicine and hormone therapy who's joining us. Now, stay tuned. You don't want to miss this conversation because we have a special offer for you, and we want your hormones, your body, and your mind to be in balance. Today, I want to introduce you to a medical practitioner with an extensive background in regenerative therapy and helping people balance their hormones holistically. William Song, welcome, and thanks for being here. Like, seriously.
Thank you for having me.
Yes. Well, tell us about yourself, but also tell us what you do.
A medical practitioner that I've taken a particular interest in helping individuals really optimize their life through not only the primary care aspect and overall health, but I've really noticed that a lot of individuals have been dealing with issues that are primarily age-related, decrease in energy and overall decrease in quality of life.
Sure.
So really taking a particular interest in hormone replacement. Pretty exciting.
Oh, it is exciting because you can stay that way.
Absolutely.
You look great, and you can be healthy and healthier, based on your circumstances, stuff like that. So, well, you've been talking about the body, but also now I'm a psychologist. How do the hormones play into like the mental health?
Well, hormones play a very important role in mental health, primarily because if somebody is, say, for instance, dealt with a lot of traumatic stress, repeated exposure into stress, it could really change the overall composition of the hormones of the body, which will affect their overall health.
I see it on my end. Okay, now I'm a counselor. People fly and come see me and talk to me. And I remember a lady who was diagnosed with depression. When I talk to clients, I say, well, if you're depressed, let's check your hormones, let's check your thyroid. Let's find out what's going on in your body before we start taking the medicine. Because those medicines have severe side effects and they can actually be worse than the symptoms you already have.
Right.
And so I remember I had her get her blood drawn, like what you guys do. And she came back with the results and her testosterone was zero. I go, yeah, you're depressed all right, but it's not because you're depressed. It's because you have no testosterone, right? And she was like lit up about it. She's like, wow, that's my problem.
It's life-changing.
And of course they weren't having sex. She had no sex drive, and she got a lot better, a lot quicker. I mean, she was so happy that she actually found out what the problem is. What I like about what you do is, you do an assessment that can help people to find out what the problem is and where it is.
You're exactly right. That's where it starts. It starts with getting the labs drawn. In relation to that particular story, what I find is a lot of individuals that we see have a very similar story where they notice a decrease in their overall energy and their sex drive or libido, go to see their primary care. They're actively seeking help. A lot of women see their OBGYN. And oftentimes they are prescribed antidepressants. And a lot of our patients have no particular interest in antidepressants because they don't feel like that's their issue. They know that there's something underlying that's wrong. So when they come to see us, like you said, we send them to get their lab work done. And oftentimes we could find out what their issue is, such as a dramatically decreased testosterone. There are a lot of misconceptions about hormones, particularly with women. I think a lot of women might not even realize that they have certain levels of testosterone. So it is really a life changer for a lot of our, for our lady patients and even the males to find out that they were right, that there is something underlying that can be corrected without the use of an antidepressant.
Well, and I think there's, just a level of misinformation because someone feels anxious, they want to go see a psychiatrist. If they feel depressed, they want to go to their general practitioner and they want to pop a pill. And I think that there's a lot of cross symptoms. Can you talk a little bit about that? So, like my experience is when I have a lady or a man who's depressed, I say, get your hormones checked out. With anxiety as well, get your hormones checked out, because I find that there's an overlap between what someone's experiencing as far as like anxiety or depression, and it really is their body. Can you talk to that?
The medical and scientific community have already found out that certain decreases, or when it comes to hormones, there needs to be a balance, and it needs to fall within a certain spectrum. If a particular hormone is too low, for instance, which is the case with a lot of our patients, oftentimes that will create significant mood changes, irritability, decrease in sleep quality, insomnia, memory issues. We get that complaint often, the foggy-headedness. People know when something's not right with themselves. They're normally very sharp. Some of our patients have incredible responsibilities, and all of a sudden they realize that there's something not right cognitively. They're really suffering from that foggy.
Those overlaps are like in the normal population. One of the things I deal with, is men and women who were traumatized, they were sexually abused, they've had some kind of PTSD experience, they've had infidelity, or they're living with some kind of addict, alcohol, drugs, sex, whatever. Sure. And the trauma of that. Can you speak to kind of how that hits the body?
Yeah, and that's, unfortunately, I do believe that is a subject that is often overlooked and is stigmatized. So my belief is, I think a large amount of the population dealt with some level of trauma, not to mention children that have been physically abused or witnessed physical abuse, between parents. I know a lot of individuals are probably familiar with the term, the fight or flight syndrome.
That's real.
And that's all hormone related. It's a non-cognitive, it's your body reacting to an extremely stressful situation. It's the release of certain hormones, such as your adrenaline and cortisol. These hormones, constant repeated exposure with individuals that have suffered traumatic stress.
Can they stay jacked up?
That's where it gets a little bit tricky, right? So the fight or flight reaction that our body naturally goes through is extremely important to nature. However, we do know that repeated exposure can then cause lots of long-term type issue, physical issue, unless we can identify it and have it addressed to help individuals, with these abnormal stress levels.
Now, how can someone easily figure out if they've got some kind of imbalance issue?
It always starts with the labs. And it always starts with lab draws. Because with that information is the most critical step.
Like the basic of it, it's a thorough thing.
Yes, absolutely.
I did it, and it's pages. Okay, but it's really helpful information. It's not just like, okay, here's your 4 hormones, and this one's like waft. No, it's not like you're just a quick little panel. It's like this extensive thing. Crap about that.
At Amazing Meds, we're committed to really optimizing the health of our patients. So it's not only the hormone levels that we check. Of course, we include the thyroid. We include the metabolic panel, which, checks your blood sugar, your kidney function, liver function, your blood counts to see if anemia might be a cause and how we decrease in energy. We like to be very thorough. So essentially, our lab panel that we typically draw for our patients it's the same labs that you would get with your primary care doctor or your OBGYN. In addition to that, we also we like to check your thyroid hormones, your testosterone, your estrogen levels.
As a follow-up, we're talking to someone like what this actually means. I found that to be really helpful.
Yes.
I got a PhD, I got 4 degrees, but having the nurse practitioner walk through that and share with me what this really means for my body and what I can do with it was super helpful. Now, Amazing Meds wants to make some kind of special offer, so I'll let you tell the audience about that.
At Amazing Meds, we really want to utilize technology, extremely convenient, and we want to make sure that everyone knows that wherever you are in the country, you can contact us, and we have an amazing staff that will help assist you with finding a lab to get your lab panel completed, and we make it really convenient for our patients to get this information if they suspect that there might be an issue with their hormones. We have a special offer, a special discount. I do want to stress that getting the lab panel is extremely important and extremely powerful information. Our staff is very committed to being very responsive to our patients. We make it a goal to get those results to our patients.
Well, I want to thank you for spending some time here with me. And I want to thank you for watching today. And really, I really have been talking about hormones and the effects of trauma and all this stuff on people's lives. But even just anybody needs to have the hormones checked on a regular basis. And what I like about Amazing Meds is no matter where you are in America, you can call their office. They can tell you just go down the street, cross town, go to this lab, and then you get your blood drawn, and voila, and, in a short period of time, you have this like multi-page report. It's really colorful. And then you can have someone intelligently go over it with you. And then you can feel like you did some kind of like healthy thing for yourself. And then, I talk about self-care a lot with my clients. And this is just good self-care to know what's going on with your body and to be able to say, oh, I need this or this maybe to help me to get to a better place. As you've been to any kind of trouble, definitely want to do this. You deserve the best body possible. And I know Amazing Meds can help you get that. And you'll feel like, I know what I'm doing intelligently instead of just going to the health food store and trying to grab something off the shelf. You might not need that. You might need this. So please call the number there and use the code, get the discount, and really have a healthy body and life.